this whole issue of the CDC and these public health agencies, look, public trust in the health regime in this country is as low as it's ever been.
But why, Scott?
Because of COVID.
Right.
Because of school closures. Because of mask mandates. Because this country was...
But
let me just finish. Because this country was drugged through a bunch of condescending and heavy-handed mandates that all turned out to be garbage, and that's why it's low, and the questions are valid.
And suddenly you're saying, well, if only there weren't these questions that I made up. You cannot just create doubts and then blame the doubts that you created for the skepticism.
The doubts in the public health regime in this country were not made up out of whole cloth. They are fully derivative of what happened to this country during COVID and the people and the families and the businesses who were devastated by these mandates.
This is from ABC News. The headline that just appeared a few days ago, which if we're talking about pandemic preparedness, and with all due respect to the committee and the work, the fact that we're considering to bring somebody on with no scientific or medical credentials, who's falsely claimed for decades that vaccines cause autism, who has quite frankly said just outrageous comments about science and medicine, that this person would come in to gut the NIH, I think is shameful. I think is shameful. And Ms. Greene, you can clap all you want, but it is shameful, it's dangerous, and if this committee is about pandemic prevention, we should be very concerned as a country that RFK Jr. could be put in charge of health when he is a vaccine denier and has caused great harm to the American public. I want to say just finally that I'm very concerned that someone that wants to gut the NIH, HHS, and other services could be put in charge of health of any kind in this country. And so I want to thank you, sir, for your service